Okay, tell us a little about your job title and some of the things you help clients with.
My name is Lynn Perry, and I'm a registered dietitian, licensed dietitian nutritionist, and I work in an outpatient setting helping primarily patients who are diabetic, suffer with coronary artery disease, and those looking at weight loss options.
Okay, so in the big debate of regular soda versus diet soda, which do you recommend to your clients?
Well, if I'm helping a diabetic or an overweight patient and they are looking for an alternative to regular soda or sweet drinks, I will certainly encourage them to try diet sodas or other diet drinks such as Crystal Light, Mio, artificially sweetened tea, etc.
And why is that? And why do you recommend the diet sodas?
Well, I would much rather see someone drink a diet drink or an artificially sweetened drink over regular soda or a lot of juice or a sweet drink like Gatorade or lemonade. And certainly water is my first beverage of choice.
Okay, what sweeteners used in diet soda are you most familiar with? What do you know about them, and do you know of any positives or negatives associated with these sweeteners?
The most common sugar substitute, or as we refer to them, non-nutritive sweeteners that are found in diet drinks are NutraSweet, which is what's aspartame, also sucralose, which is what we know commonly as Splenda, and then occasionally you'll see a mix of acetylcysteine K and Truvia, which is the newest sugar substitute out there. To my knowledge, is not in drinks yet.
Okay, do you know any positives or negatives to these sweeteners?
Clinically, they've all been found to be proven safe and efficacious to use on a regular basis. However, because they are some of them newer on the market than others, there are always evolving studies taking place. I encourage everyone to drink water, or if they prefer something sweet, that they try to use something with a sugar substitute on a moderate basis, because anything in excess is never a good idea.
Okay, there was a study conducted in 2009 that stated that a person that daily consumes diet soda has a 67% greater relative risk of incident type 2 diabetes compared to those that did not consume. Why do diet sodas increase the risk of diabetes?
I'm not real familiar with that study, so I can't speak exactly to what their study was based on. But from the sounds of it, I'd have to assume that many people who are prone to type 2 diabetes and who are already drinking diet soda are already predisposed for developing type 2 diabetes. They may have been pre-diabetic and they were already overweight and therefore drinking diet soda on a regular basis. So I can't conclude that the drinking of diet soda is actually the cause. So I'd have to want to read the study in detail. I can tell you that the Academy of Food and Nutrition, which I'm a member of, has a position paper on the use of non-nutritive and nutritive sweeteners in beverages, and they've not found a corresponding link between drinking diet sodas and a higher risk of diabetes.
Okay. There is a carcinogenic potential of aspartame, a sweetener that is used in many diet sodas, which you have mentioned earlier. Many studies have been conducted with aspartame-fed lab rats, resulting with them with brain tumors. What is your opinion on the potential harmfulness of aspartame?
Well, with any food product, I would tell someone, if they have a reaction to it, not to eat or drink it. The study that you're alluding to with the rats, they were fed excessively high quantities of the aspartame. And again, I would say in moderation, I see no contraindication for people drinking drinks substituted with aspartame in place of sugar. But if the person themselves feels like they're having a reaction or has concern over it, that's why there are choices out there. First choice being water, plain tea, that they could make lemonade without adding any sugar themselves, or again, water just enhanced with lemon or lime or orange. So there are other options out there.
Okay. So what artificial sweeteners do you recommend to clients as the safest and best to use?
Most recently, because of the addition of Truvia on the market, which is made from the plant stevia. And stevia is a natural sweetener that is found in the plant leaf. You can actually take the leaf and run it over your teeth and taste the sweetness. People who express concerns about safety, I encourage them to try Truvia, since it has been proven to be the most natural occurring sugar substitute.
Many believe that drinking diet soda is better because it's 0 calories. Do these beverages really aid in weight loss?
I'm not convinced they do. No. I really think some people fool themselves into thinking because they're drinking a diet drink, they may then inadvertently consume more calories in another form. So I'm not convinced that they do aid in weight loss efforts. I think they're very advantageous for someone who is a diehard soda or sweet drinker and is looking for a substitute, and water is just not meeting their expectations.
Okay, so to conclude, what drinks would you suggest are better to drink than diet sodas?
Water.
Okay, great. Thanks for the interview.